So, you know how in trauma care, the first few seconds can literally make or break a patient's outcome?
Absolutely.
It's incredible how critical those initial moments are.
Yeah, I've always been fascinated by that. What's the biggest challenge clinicians face right at the start?
Well, one of the major pitfalls is failing to secure the airway early in critical patients.
Right.
You'd be surprised how often that's underestimated.
Really? Even with all the training?
Yeah, it's like sometimes they see a patient who seems stable, but there's progressive swelling from, say, facial trauma or burns,
Mm-hmm.
and then suddenly the airway becomes compromised.
So the key is to act before it gets to that point?
Exactly. Always assess airway patency first. If there's any hint of obstruction or risk of swelling, you need to secure that airway pronto.
Makes sense. What's another common issue?
Delayed recognition of tension pneumothorax is a big one.
Oh, yeah.
Clinicians might miss subtle signs like decreased breath sounds or distended neck veins.
So they're waiting for the more obvious symptoms?
Exactly. But by then, it can be too late. It's crucial to perform a rapid assessment and, when in doubt, not hesitate to decompress the chest.
It's like the window for intervention is so small?
Yes. And another thing is overlooking cervical spine stabilization.
Right.
In the rush, sometimes spinal precautions are forgotten.
That's dangerous because you could worsen a spinal injury, right?
Precisely. You have to assume a cervical spine injury in trauma patients and maintain inline stabilization until it's ruled out.
Got it. Any pitfalls in managing shock?
Oh, definitely. Failure to recognize shock is a huge pitfall. Clinicians might rely too much on normal blood pressure readings and miss early signs.
Mm-hmm. So they should look beyond just the blood pressure?
Exactly. They need to monitor for tachycardia, altered mental status, narrow pulse pressure, and use lactate levels or base deficit as additional clues.
Interesting. What about managing external hemorrhage?
Ineffective control of external hemorrhage is another pitfall. Some clinicians over-rely on IV fluids instead of addressing the bleeding directly.
Right. So direct pressure and tourniquets are essential?
Absolutely. You need to use direct pressure, tourniquets, or hemostatic dressings immediately to control the source of bleeding.
It's like treating the cause, not just the symptoms?
Exactly. An incomplete exposure of the patient is another issue. Sometimes, due to time pressures, patients aren't fully examined and injuries get missed.
Oh, wow. So they should fully expose the patient but also prevent hypothermia?
Yes, that's crucial. You need to expose the patient to find all injuries but also keep them warm with blankets to prevent hypothermia.
Balancing thoroughness with care?
Exactly. And ineffective communication during handover is another pitfall that can have serious consequences.
Yeah. So like using structured communication tools?
Yes. Tools like SPAR, situation, background, assessment, recommendation, can make handovers much more effective.
Makes sense. Any issues with imaging?
Overlooking the need for early imaging is a common pitfall. Some clinicians hesitate to use CT scans in unstable patients.
But imaging can be crucial, right?
Absolutely. Imaging should be used judiciously to ensure it doesn't delay life-saving interventions, but can provide vital information.
So it's about finding that balance?
Precisely. And another pitfall is neglecting the role of the team leader. Without clear leadership, resuscitation efforts can become disorganized.
Yeah. So assigning a team leader is critical?
Exactly. A team leader oversees coordination, prioritizes tasks, and makes critical decisions, which can significantly improve patient outcomes.
That's so important. Any other pitfalls we should be aware of?
Well, missing subtle neurological changes is another one. Clinicians might focus on overt injuries and overlook signs of neurological compromise.
Right. So regular neurological assessments are necessary?
Yes, conducting frequent neurological assessments, including Glasgow Coma Scale scoring, helps monitor for any deterioration.
It's a lot to keep track of.
It is, but being aware of these pitfalls can make a tremendous difference.
Absolutely. This really highlights how vital thoroughness and vigilance are in trauma care.
Exactly. And by addressing these common pitfalls, clinicians can elevate the standard of care and ultimately save more lives.
Well, this has been enlightening. Thanks for breaking it down.
Anytime. It's a topic I'm passionate about.
And it shows. Looking forward to our next discussion.
Me too. Until next time.